So this patient's prescription tells us a lot about them. If you're a trainee pharmacist or a medical student, keep watching, and this is how I break down any drug history or prescription as a clinical pharmacist. Hi guys, my name is Tanvir. I'm a UK clinical pharmacist and a first year graduate entry medical student, so let's break it down. If you haven't watched part 1 already, then go check it out and then come back and watch this. Empagliflozin is an SGLT2 inhibitor, so typically they were used in type 2 diabetes, they still are. However, they are also now used in heart failure because there have been several studies to show how they can improve exercise tolerance, reduce symptoms in patients, as well as reduce deaths related to heart failure. These drugs, as the name suggests, these inhibit the SGLT2 transporter in the proximal convoluted tubule of the kidneys, increasing the amount of glucose and sodium that we excrete in our urine, and by promoting diuresis, it helps to reduce preload and afterload, and so reducing the strain on the heart overall. It's really important we counsel the patient to stay hydrated, and we counsel them on signs of diabetic ketoacidosis because there's increased risk associated with gliflozins. Lastly, we've got Sacubitril and Valsartan, which is a combination drug commonly known as an Entrestro. Sacubitril is a neprilysin inhibitor which increases the amount of natriuretic peptides to cause vasodilation, natriuresis, which then helps to lower blood pressure and reduce fluid retention. Similarly with Valsartan then is an angiotensin II receptor blocker, which causes vasodilation, helps the blood vessels relax essentially to lower blood pressure, and both of these drugs together then can ease the strain on the heart. We want to monitor the patient's blood pressure, their UNEs, and particularly their potassium because of the Valsartan, and we want to make sure they have a 36-hour washout period if they have been on an ACE inhibitor such as ramipril. Entrestro has been shown to reduce deaths as well as hospitalization related to heart failure, so it's a key drug used as part of heart failure management. So this is a patient who's post-ACS with heart failure, and understanding why these medications are prescribed and how they work is essential then to counsel our patients and make sure that they take these medications regularly to improve their health outcomes, reduce hospitalization, and hopefully reduce deaths. If you enjoyed watching this video, you found it useful, please do hit the like button, please drop me a follow. If you have any questions or any suggestions, then please drop them in the comments. Take it easy guys.